All right, welcome everybody. This is Dr. Dickon Weatherby. Welcome to another Success Stories. I'm joined today by Jonathan Cohen. Jonathan received his Master of Science in Nutritional Therapy from the University of Worcester in the United Kingdom and has over 20 years of multidisciplined experience in healthcare. Currently, Jonathan holds the positions of Treasurer and Director of the British Association of Applied Nutrition and Nutritional Therapy and is registered with the Complementary and Natural Healthcare Council. He is also the clinic director for the Center for Applied Nutrition and Health in the United Kingdom. Well, welcome, Jonathan. Perhaps you could start out telling us a little bit about your background, a bit about your practice and the type of patients that you see.
Yes, well, my practice is a multidisciplinary practice. I see patients from all walks of life with a variety of different conditions. So I tend to specialize in complex cases nowadays. I am a nutritional advisor for the Multiple Chemical Sensitivity charity MCS Aware in the UK. I'm also working with a group of people who've been poisoned by organophosphates. These are primarily farmers and associated farm workers and their families, so there's lots of epigenetic effects as well, and trying to help them with the effects of organophosphates. I will work with anybody who is willing to work with me, and anyone that I think can help and benefit from necessary nutritional and other advice.
Terrific. So given the type of patients that you work with and what you just described, I mean, obviously you must have some assessment tools that you're using. Obviously, blood testing is one of them. Can you tell us a little bit about sort of your approach to assessing clients?
Yeah. Well, I was, as part of my training, and particularly in my master's training, using a functional medicine approach has been the underpinning modus operandum for working with and assessing clients. I mean, I always start with questionnaires. The questionnaire that I've always used, and the one is my preferred questionnaire of choice, is the one which you yourself devise, which I find an invaluable tool. In fact, I insist that my patients answer that, otherwise they tend not to become my patients, because I believe it's really important that people are willing to invest a certain amount of time into their health and well-being, and answering questions is important. At that point onwards, once I meet them and I try and get them to do a full blood chemistry analysis, and the results of which will lead me into, if you like, laser pointing where other interventions and testing is required, be it stool analysis. I won't mention company names, but it could be any one of three. They usually tend to be American. It may be assessing adrenal function or hormonal function. But my first port of call is always questionnaire, and for testing is always blood chemistry analysis. And the blood chemistry analysis, and I'll say it consistently probably through this process, is the best tool I've ever come across, and the one I recommend to absolutely everybody.
Terrific. Yeah, me too. You and I have been colleagues for a while, and you used my book and stuff like that. I mean, I think one of the interesting things talking to you before the software was just the amount of time that you were spending doing your analysis. Perhaps you could speak to a little bit about what your life was like before the software tool.
Yeah, well, many years ago when I was a young man. I started off, I think it must have been about 2006. Certainly around 2006, 2007. That's when I came across this tool, and it was a book. And that's all that there was. And I had no idea, very little background in blood analysis. And certainly not in blood chemistry as it was portrayed. And I used to take people's blood test results that they had, and I used to enter them into a sheet by hand with little arrows for ups and downs, and stars or double arrows for really up, or double down, if they were clinically low, and little stars and notes and scribbled notes, and opening up the book and cross-referencing from page to page, and then trying to scribble notes. And I would end up, after about 2 hours of analysis, with lots of notes which I hope I could read and make sense, particularly when I was going to speak with a patient. And of course, my wish list, as you knew, as the time was, wouldn't it be great if this was computerized, and wouldn't it make a change? And from 2 hours to less than 15 minutes, for entering and assessing, is just fantastic. I can't thank you enough, and I can't say how happy I am that my life is made so much easier.
Oh, it's gratifying to hear. And so you and I have also talked a lot about how this software is not diagnostic. And we have to really stress the difference between diagnosis, which is, the realm of allopathic physicians, diseases, tissue changes, and that type of thing, to the realm of functional medicine, functional diagnosis, where we're really, assessing for the underlying cause. And you've talked a lot about health trends to me in the past. I wonder if you could speak a little bit about sort of that concept and how you apply that to your practice, and how you talk to your patients about what it is that you see when you're looking at the blood test report and that type of thing.
Well, when I get a report out, the first thing I always do with every patient I have, I'm not a doctor, and therefore my ability to state I'm making a diagnosis is clearly impaired, and it's not something I wish to do or wish to fall foul of any authority over. Moreover, what I'm most interested in is heading people off before they get to the pass, because when, realistically, when people get into clinical dysfunction, in other words, their results show that they've fallen into serious issues, be it cholesterol, or any of the lipid panels, or the thyroid panels. At that point, they really need to be under the supervision of their registered healthcare or chosen healthcare professional, which, quite frankly, at that point you can be pretty assured that the chances of them receiving a natural or nutraceutical intervention are pretty slim, and they're going to be into the synthetic pharmaceutical approach, with all of the sad side effects that are possibly likely to occur because of that. And once on that treadmill, getting off of it is really, really hard. And here is a tool by which you can have a client who comes in, or a patient, and they can state that they're not feeling 100%. They can mention certain symptoms, and you can start making some assessments based on experience. And then in black and white, you can see in front of you that there is a trend away from an optimum norm. That part in the center of that bell curve that is perfect health. And you see people in that particular sphere, not many, but if you get them, you go, there's nothing there. As far as I'm concerned, the metabolism and the results are perfect. But then the people who fall just outside of that, before they hit the clinical dysfunctions, i.e., the lab beginnings and ends of the ranges, you can say you're trending to or away from an optimal norm. And that's what I like to tell them, is that I am looking at you to diagnose health trends that conventional blood analysis misses. Because we can find that, we can see where they're heading, and we can warn them. For example, you can see a trend towards sugar mismanagement, coupled together with various other factors, whether you're looking at potential risk of metabolic syndrome developing, that cluster of events and dysfunctions which you really want to avoid, and everybody wants to avoid. You can head them off. You can give them the advice, the warning that, if they keep on with their lifestyle where they're going to, moreover, you can then say to them, well, look, if you get to that end point, these are the kind of life events you can be looking at. I'm giving you the choice now if you want to get there or not. And if they say, no, I'd prefer to turn the clock back, you've got the opportunity to reverse their health trend and help them do that. And again, I reiterate, I know of no better tool than blood chemistry analysis in the way that it's presented as the first line to get people to do exactly that. And the beauty is the report that they get is visual and indisputable. They've got plenty to read and there's plenty to explain.
So in some ways, it's truly preventative medicine is what we're doing here.
Absolutely.
And this is a tool that allows us as clinicians to really practice that art of identifying health trends, identifying where people could be going to, and how we can actually stop it from happening.
Yeah, I mean, there are two aspects to this. One is obviously that clearly I'm in the UK and you're in the USA, so there's a different set of models. Ideally, we all want to capture people and for people to have their health explained to them where they are on their road at any one time. Here is an ideal opportunity to help them as a preventative and to a certain extent restorative measure. I won't use the word curative because we try and catch them before there is a need for a cure. The other side, of course, is that here is an ideal tool that for people who are in healthcare to utilize to encourage people to come in to their practices because it gives them an edge and obviously a way for their patients or clients to come in to see exactly where they are. So it's another practice tool and another practice benefit. It creates value, and of course, high quality client management. The time it saves, the results that are achieved, are speedy, and I think, gosh, how many there are potentially at the moment, something like 80 markers that can be applied into there. That is a absolute massive amount of data that it can be crunched into comprehensive and comprehensible results in the matter of minutes.
Yeah, it's really quite remarkable, actually, when you think about the number of elements that are included. So, well, any final words that you might have? I mean, this audio might be an inspiration to nutritional therapists like yourself, who may not be as aware of what this tool can do. Are there any sort of parting words that you might have for a nutritional therapist who might be listening?
I would say to anybody that may be listening that is in the business of establishing trends for their patients, that there's an opportunity for them to produce a sophisticated and very detailed health report. The beauty is they can track their clients' progress because there are the facilities in here to see how there is a progression over time. It's visual. You can see the last 5 tests at any time in this. You can see how people are moving along there. Of course, there's added value. The time is saved, and it makes anyone as a practicing professional more effective and enables them to achieve high levels of success quickly. It's a win-win situation all round, and I completely recommend it wholeheartedly.
Well, thanks very much indeed for that, and thank you very much for taking time out of your busy evening to share your thoughts with us, and appreciate that very, very much. So
it's my pleasure.